Welcome to the last panel of the first edition of the Conférence pour le Brésil. Antes de começarmos, gostaria de lembrar a todo o público que o painel com áudio ao vivo em português está disponível em nosso canal no YouTube. My name is Gabriela Furtado. I am a Master in Human Rights and Humanitarian Action from Sciences Po, and I am part of the operational team. On behalf of the organizing team, I come here to thank everyone who made this conference the success it has been. First of all, I would like to thank our partners, Chidisituba Foundation, Sciences Political Observatory of Latin America and the Caribbean, Educalibras, and Headline, which enabled us to create an online event free of charge with simultaneous interpretation into English, Portuguese, and Brazilian Sign Language. I also take this opportunity to thank the companies TraduPoints, responsible for the simultaneous interpreting of all the panels, and the Estúdio 42, which broadcasted live all of our events. I could not fail to mention the students and alumni of Sciences Po, who were in charge of the elaboration and execution of the Conférence pour le Brésil, as the event should have taken place on site in Paris and ended up being in the new online format. Certainly, everyone's effort and dedication are reflected in the quality and success of our event. We would like to thank all of our speakers and moderators who volunteered to participate and enrich the debates in all of the 13 panels. And finally, we address our audience who followed us, interacted on social media, and motivated us to continue with this very important work. We hope the Conférence pour le Brésil had a positive impact on the lives of everyone who attended the project, bringing new ideas, concepts, and proposals to the debates on inequality and development in our country. Please welcome Denize Ornelas, who is going to be the moderator of the Health Access panel. Thank you. We have no sound coming from Denize at the moment. We cannot hear Denize. Awaiting. If not the most important, which is the base for the development of all the people in the world. We have Eloy Terena today. He is responsible for APIB with the articulation of the indigenous people in Brazil. I'm saying everything really fast, so you can correct me later on, Eloy. He is part of the indigenous people and originary in the native village of APIB, and works on the articulation of indigenous people, and he is acting and supporting actions in the superior international and the international courts. We also have Raull Santiago with us, a social entrepreneur and a member of the crisis committee, a human rights activist for climate, and the CEO of Brescia Agency of Communication, a founder and part of the collectives called Papo, Reto, Movimentos, Perifa Connection, and he is also part of the meeting of the members of the International Amnesty in Brazil. He is a member of the global network of defenders of the human rights, frontline defenders, and he lives in the Alemão slum complex, and he also takes part in the committee of crisis there. Deisy Ventura is a professor of ethics at the Public University of Health at USP. She is in charge of the department of the postgraduate of health, environmental health, and coordinator of the program of post-graduation in global health and sustainability. Also teaches in the international relations course at USP, and she is the president of the association, Brazilian Association of International Relations, named ABRI. She's going to be there until 2021, and she's a PhD in international right. Paulo Buss is a professor, a doctor, a public health physician, and researcher. He was the president of Fiocruz from 2001 to 2008, and he represents Brazil in the WHO's World Health Assembly. He was there from 2008 to 2019. He has written more than 3 books and 80 articles on health, and he was awarded with Ordem Rio Branco and Ordem de Mérito Médico, the highest honors granted by the Brazilian Federation. We are going to start with Eloy with some important. You are aware of the dynamics of this seminar. They are going to have from 7 to 10 minutes to talk to us, and then you can ask all the questions you may want to online, and then we are going to talk to everyone else to debate all the discussions you propose. Eloy, in the fight of the pandemics, let me just go straight to the subject. We see the negligence of the public policy towards the indigenous people. In this regard, what are the actions that the Indigenous People Association is taking just to ensure the right of this population? Good morning. Good morning to you all who are following us here. I would like to thank Denize for the introduction, and I would like to also greet all of my colleagues who are going to be here in this panel, Dr. Paulo, Deisy, and Raull, who are here with us today in the morning. My name is Eloy. I am part of the indigenous community Terena. I am responsible for APIB, which is the Articulation for Brazilian Indigenous People. And we look at, with very concern, to the advancement of the pandemics towards the indigenous people in Brazil. This pandemic started exposing structural problems that there were, which were existing before, and we need to ensure protective measures for these people because it is important to include the protection of such territories. And we are not talking only about land, but we are talking about land that are not delimited as well. There are several procedures that are not concluded, and the lands that have already been marked, they are being invaded by log companies and also land grabbing people. And regarding the subsystem of healthcare towards the indigenous people, the pandemics came and triggered the problem, the structural problems that the indigenous people were already facing. And this affected the cultural identity. And according to 1988's constitution, ethnical diversity should be ensured. But we have been facing the action of public actions from organizations who are not ensuring the access to such uh, right that the Constitution grants us, and the lack of teams in service delivery to the indigenous people, and the lack of attention to their mother tongue, and the lack of provisions to them. This was a problem that was already a concern, but with the pandemics, things got even worse. And this systematic omission from the government in the scope of APIB, we are calling all of the indigenous people through an assembly, and researchers and indigenous leaders have attended this meeting. And during this meeting, we are asking people to respond to APIB's claim and help us build a plan for the fighting against these concerns we have. We already have asked all of the indigenous leaders to build a barrier on their villages and help with the articulation with the federal government, and including the creation of laws that can foresee the protection of the land and of the people. And for the first time, we had to claim at the Superior Court on behalf of the indigenous people in Brazil, because some of the fundamental rights are not guaranteed, although they are in the Constitution, just to demand from the Brazilian government that they take a number of actions. For example, sanitary barriers to block isolated indigenous villages, an elaboration of a plan of fight to help the indigenous people, also a creation of room for this debate. Now they have to sit and listen to us. The meetings are happening. The Superior Court has determined that these meetings should not stop. And in regard to this general plan of fight and structuring, I'd like to take this opportunity to say that the pandemics is already 10 months long, and the decision from the Superior Court was made 6 months ago, and still we do not have proper policies or proper plans to fight against all the problems we are facing. The two previous versions of this document that were presented were lacking technical concerns, and there were no KPIs to be met, and they sort of foresaw a date to start the tourism in the area when we still have the pandemics and sometimes even the lockdown. This is all being addressed to the Superior Court, but still nothing has happened towards the protection of the indigenous people. So these are my initial comments. Another APIB claim was the removal of invaders from indigenous lands. We have a very high rate of invasion now. And the Yanomami land, for example, which is a land that is defined for quite a long time, there are more than 20 artisanal miners exploring that area. They are exploring the indigenous villages, and this during the pandemic, these agents being there means they are vectors of the virus. And And sometimes, most of the times, these are isolated people who do not have access to other people. So I'd like to bring this to the table for discussion. We need to ensure their education and their health, and we need to acknowledge their territorial frontiers. The lands are already marked, and we need to look at such specificity that comes then that are part of the indigenous people. The Indian, it doesn't matter whether they are in a city or in a marked land, they are still Indians. And although it's been discussed, we still face a few problems at the legal level, whether they use a cell phone or wear normal clothes, whether they have or do not have a right to their cultural asset.
So here, especially when we're talking about protection to health, this is a very serious matter. Thank you. Thank you, Eloy. It's very important for you to bring this perspective. And I think in fighting the pandemics, inequalities, as you mentioned, have increased and got worse. We saw new inequalities and new difficulties, especially for the vulnerable people. And this fight of the social movements and the articulation of indigenous people, LGBT people, Black people, who are people on the streets, people with disability, who are all more vulnerable to violence and all, had to get organized and in many times fight together. For example, Amnesty International in Brazil has been important in that, and I've been with Raull in that, with the Society of Family Health also, and this fight is very important in this area, especially Raull, who is a social organizer working at the Alemão complex, uh, and I'm here in São Paulo, in São Bernardo do Campo. We realized early on that there were very many gaps, as Eloy mentioned, in the contingency plans, not only regarding the indigenous people, but with a vulnerable population in general. Então, how continue on? My question to you is, since the launching of the national contingency plan against the pandemics in February, you already noticed the negligence regarding access to water, basic hygiene products in these territories that already have some other problems before the pandemics, but which are essential in the matters regarding the protection against the pandemics, like the lockdown, the use of masks and everything. And the communities couldn't do the enter this process on their own, and they needed government support. So I wanted to tell you, how did the social movements get organized to fight this, and how you see all that throughout the year? Good morning. Congratulations to you all on this great, important event regarding the situation of our country. In the slums, in the periphery areas, when you talk about Brazil, there are many situations that we have been observing, starting from the Alemão slum complex. Starting with a mobilization we started in March. Camila Santos, known as Camila Moradia, she fights for housing rights. She created she launched a tweet marking me and Cida and calling us to get organized, asking what are we going to say in face of this reality ahead of us. Something we know that if it gets to the peripheries, things are going to be much worse. What do you say we get a crisis group together? So the next day, this became a WhatsApp group and a work front called Crisis Commission of the Alemão Slum Complex. And with other communities, we participate, Papo Reto, the community led by Camila. So we wanted to do some communication work, but the communication work that would take into consideration the reality of the historical inequality we live both in the slums and the peripheries, where we don't have basic sanitation, basic water, uh, which are basic rights. So several historic deaths that were not taken into consideration in the contingency plan. So the basic was understand how the recommendations of the WHS were and trying to strategically apply that to our reality. So when WHS, the basic says the basic thing to try to stop the spread of the virus is to wash our hands with soap and water. How can you tell a population that doesn't have proper water supply how to do that? Okay, you have to wash your hands with water and soap, but you don't get water every day. Most days you don't have water when you turn on your tap. So how can you do this in this reality? So during the lockdown and education of social isolation, how are you going to do that safely when you have families of up to 10 people in a reality of inequalities, living in a house with 2 or 3 rooms? How can you talk about social isolation to them? And how can you talk about individual isolation if one of the people of this family is contaminated? How do you isolate one person in a house with 3 rooms where 10 people live? So it's a very recommendations are completely in contradiction with the actual reality of these communities. So this is something we brought to our communication areas, started working our way, got partnerships with sound cars, people who could print material for us. And we started doing what those guys who create events in the areas do. We got the sound, these cars going around with a kind of song they like and saying why, with recommendations like, okay, if you have two water recipients in your house, contain big ones that you can help spread water or lend water to your neighbor, do that. And several other recommendations, so we could try to fight and obey the recommendations given by the WHS, but within a very hard reality. When you look at the the Alemão slum complex, we have several slums together. It's a hill, it grows going up. You have smaller streets, main streets. This is where the life happens. People are on the windows, on the streets. You have smaller homes. Many of them are not clean. They are made of wood. So life happens when you're together. So it's very hard to get this reality and try to isolate it as immediately as necessary by the pandemic. So it was very hard work, but it came on, it went on for a long time until the first moment with the isolation relaxed. But after 2 years, 2 weeks into this, we had to face several other difficulties. Had to start debating several other problems. And when we're talking about this reality, people who have to be entrepreneurs to get uh, basic supplies. They work during the day to guarantee food for the next day. We're talking about people who bake cakes for selling, people who work in events, people who make food to sell on the beach. So when I go into isolation, this directly impacts the life of the people. And unfortunately, in this inequality situation, we started to have a serious problem of hunger. So in addition to the communication front, we had to open another channel for direct donation, and it's something that has been going on up to now. We started asking for basic things from food and alcohol, hand sanitizer, other hygiene products, and then suddenly we had even more immediate problems like uh, other basic hygiene products for the population. And we had to think about how we were going to work. We have a group of 30 people. We managed to get a donation of a huge warehouse where we were together. We had space to do this work in this warehouse. And every day we received donations, cleaned everything, and thought on how we were going to distribute this without putting ourselves in risks or bringing risk to the people we are distributing that. So then we had to get organized with the health groups in the Alemão complex, with Dr. Nayara and other doctors in the central agency, health agency in Alemão, to get tips from them on how to work and do all this distribution work. We have we have all this group on the family health doctors in the complex that helped us uh, do this work, and they are still working with us all this time. And something that is very curious about this and urgent also, and I think it's worth mentioning, of course, the crisis committee of the Alemão complex, where the people such as me who are always in public spaces, we managed to get many donations. We'll have some public presence, and many times we these health spaces in the peripheral areas, the local clinics and the public health system in this area didn't receive all the materials they had. We had to donate basic equipment and materials for these health professionals to work. So it was very serious. We had a lot of help from them, but we had to help with a public health structure in an experience that I've never seen before. So it's something that we are still thinking about, something that is still happening. It's still present, but I think this kind of summarizes what this time has been. We started talking about communication so people would be aware of the minimum sanitation uh, uh, measures they had to take. And then we went on to have to deal with basic food supply, material supply for health centers, and try to help all the families involved in the area. Perfect. How I think all this organization was something we were able to see in the slums. The central union of the slums were very present in this process, and you were real pioneers in this. Some of the experience you had, I had the opportunity to be with you in many of the programs you were, and we were able to get good results and replace the role of the government uh, in this situation. And it's the Brazilian unified health system is very important in that the Minister of Health was very slow and absent in building public policies that would get or in qualified the workers to work with the communities. On the other hand, thanks to our several years of experiences and the way we have worked with the communities, this allowed us to produce things in the dynamics of the reality, not waiting for an action plan from the federal government. This has been very real in this pandemics. It's great that you can name the people in the team, and we see that this is a reality. This is not abstract. This is really something that is happening. And then making a transition to Professor Deisy, it's a great pleasure to have her with you. I want her to, since she concentrates on SUS, the Brazilian Unified Public Health System, and it's one of the basic things about it. Uh, I want her to talk about how all this process that has affected SUS and the lack of organization and all the material in it, but how is the role of the SUS during this? It could have been worse if we didn't have it.
I am very happy for this encounter. It is an honor for me. Cienspro, in particular, the organizers of this event, have managed to gather some of the profiles of people who ensure that this pandemic is not a greater catastrophe that it is in other places. The number of very severe cases would have been something even greater to be ashamed of, and with the loss of many lives. And I think for being here with people such as Eloy, Terena, who has ensured that the Brazilian institutions acted in the delaying of this indigenous people genocide that is being fomented by the Brazilian government for quite some time now. How, with all of the collectives he represents, with this concrete action towards uh, playing the role of many of the omission uh, coming from the federal government. This is contaminating the Brazilian working population. Uh, they were contaminating in incentivizing people to get back to work for a massive infection. When this is terrible. Paulo Buss representing Fiocruz, which is a Brazilian heritage company. It's of utmost importance, and the courage to be present and exercising the influence uh, in the spotlight, but also in corridors, fighting internationally and within all of the limits that there is for public action in Brazil. And of course, Denize, I remember one of the hardest days that concerned the pandemics. I saw Denize pregnant, acting in a community, explaining uh, the app delivery people how to keep their health in a sanitized environment. And she was mentioning that, and I think Raul has also said something about this. You are all representing important fronts, and I represent the University of São Paulo, who has worked towards actions that have helped diminishing this catastrophic outcome, and we need to make people responsible for and companies and Brazil responsible for this catastrophic scenario. I cannot go without expressing my joy being having taken part of a Cienspol activity. I was a fellow professor for Cienspol for a while. I I take part in this selection of Brazilian students for Cienspol. I took part in the Observatory of Latin America and the Caribbean for Cienspol as well. And to me, I feel part of Cienspol, and it's a great joy for me to take part in this panel, in this conference, and take part of this excellent panel. And you can all watch all of the previous ones because the videos are available. And I'd like to say two things. It could have been different. When I say things could have been different, I'm not stating my own opinion. I'm based on evidence and on some of the most important reports on global health, which is the one from Johns Hopkins and other partners. They've disclosed it in November last year and considered Brazil in a rank among 125 countries. Brazil was considered the 22nd best prepared to fight a public health crisis compared to other international countries, other countries, and we were even uh, better than that was indicated. We were considered the ninth best one to respond to the propagation of an epidemic of such characteristics. So we are much ahead in comparison to many developed countries. If the international community considered us a country that was with an ongoing development and ready for such an episode, and with our Brazilian unified public health system, our SUS, with decades of fight, ensuring access to health in Brazil, and SUS is being attacked in the last few years. And what is the scenario that we see when we say that the federal government is still making the population or trying to make the Brazilian population believe that there is a precocious way of being treated against the COVID so that they can get back to work, and calculating that these lives we are going to lose are cheap for their economical goals, when we know that in fact some of the groups will be benefited from this only because for the Brazilians as a whole, we already have studies and evidence that there is no way between protection of health and the protection of economy at the same time. When we talk about this decision that is being made at the beginning of this year to make the population contaminate themselves, just lying to them, saying that they can go on the streets if they take chloroquine or any vermectin or anything of the sort, just to uh, make people believe, and saying that the mask doesn't work and stuff like that. This is just a catalog of lies uh, to elude people. If we do not do anything, this is going to be the perfect crime. Because if you're encouraging people to go out on the streets, we see Eloy, you see Paulo and Raull, and many other people who are fighting against something like this. And the Brazilian unified public health system. One of the best things from SUS were weakened when everything happened. And they are still being attacked. And now I'm going to move to my second item. One of the good things about the Brazilian health system is the immunization plans, and it's also being attacked in the last few years. We are going to talk about the access to vaccine, which is crucial for the public health in Brazil. We are submitted to the risk of losing uh, the asset of the trust on SUS and the trust on the immunization programs. I'm not talking about the politicization in a critical census, but I think that to have political awareness is important for us, and it means protecting ourselves. I am talking about the most minimum stupid uh, political and electoral interests. when we talk about the universality of the access to vaccine is going to thrown into who is going to have access to that vaccine and how is this going to unfold. And I'm going to end with one sentence. The pandemics is the old normal. There's no such thing as new normal. Everything is old and everything and the pandemics has shown the structural characters of our policies, our regimen, and the way we live. I've been studying the pandemic, when any pandemic for more than 10 years. There's no news here. There's no such thing as post normal or post pandemics. We are going to still keep on dealing with this in the 2021. And so there's one political guideline to strengthen SUS, the Brazilian Unified Public Health System, and to make the mobilization that occurred during the pandemic uh, alive so that it doesn't stop. They have to see that without SUS, the next pandemic is going to be even worse. All the perverse aspects we faced during this one will come back because if we keep on living the way we are living, the pandemics will be part of our life with uh, shorter intervals if we don't change our relationship with the nature. And we need to look at you, Eloy, and the indigenous people and learn how the humankind has to establish their relationship with nature. This is perfect, Daisy. Good to hear because it is just a thread that organizes our thought and brings an abstract on all of that and how SUS can play its role in with their possibilities and their doctrine. What has been built up to date, what we have as asset of uh, within this necropolitics that tries to destroy the health and they're moving towards uh, selling this to a private institution. This has to be minimally healthy, minimally organized so that we can fight against these forces. Without health, we don't fight for your own rights. We need to mobilize population towards their own self-defense. When we are living this now, it's funny how we've built up this panel considering the native people of Brazil who were already here before the colonizers came and those who are in the peripheries because they were also brought from the African continent to come here and work and serve us. When we think of the peripheral populations, you consider Brazil as a whole because we know the difficulties we face at all levels. In São Paulo, we have immigrants who represent part of this, refugees. São Paulo receives a lot of people from all over the world. And they were living all of these exclusion aspects during the pandemic. And just to continue with Paulo Buss, he represents the front of health in Brazil. And right now we see a change in diplomatic behavior and the way Brazil is behaving towards other countries and within its own country. I'd like you to comment the role of Brazil in these international relations and how this repositioning of the standpoint of Brazil has both in the diplomatic relations and towards the World Health Organization regarding the fight against the pandemic, because this is not going to end. This is going to reflect for even longer. And we'd like to know from you about how to control this. This is out of control everywhere. Maybe in China it's a little bit more controlled, because they know how to control people and now they know how to control the virus. We see in Latin America that there is lack of control. I'd like to know your point of view considering the diplomatic system in Brazil and SUS.
Good morning, Denise, Eloy, Raull. Uh, I met Eloy today. He's basically my neighbor. Fiocruz is next to the slum complex. We have a joint work with them, with Mare. We have direct action on how the communities get organized. Hello to all of you, and also the work Eloy mentioned with the foundation with the indigenous communities. We have a very strong group in the area of indigenous health at Fiocruz. And these I don't have to say anything. The public health faculty and the foundation of University of São Paulo, we are have a very dynamic relationship. And Denise, I want to say to you all, and uh, you represent the highest honor we can give to the health professionals in Brazil. In you, I honor all the health professionals who are in the front line against the pandemic, getting contaminated, bringing the virus to their own families, and both for those who are in primary services and in intensive care. So, Denise, honoring you, who are one of these health professionals, I want to honor all health professionals. And I also want to acknowledge with great sadness there are about 176,000 Brazilians who lost their lives to the pandemics, and this is not an actual number. We have to multiply it by 1.5, and we have effectively more than 200,000 deaths in Brazil, and also the huge feeling, suffering that up to yesterday, for December 4th, the Brazilians who are acknowledged as having been infected with the virus in several different seriousness levels. I would say that we have 30 million cases in Brazil. We have to multiply it by 4 because this is the estimate made by the our specialists in the Fiocruz. The This is the numbers we expect. I also want to thank Science Po Paris for this invitation, and I want to uh, mention how much I admire your work and this conference that we're having the honor of closing with this last panel. In 2009, I was part of the group of Brazilians who represented the Ministry of Health, who created the Union of South American countries, one of the most beautiful projects held in Latin America in sharing political desires and dreams, and also concrete uh, achievements. In 2018, no, 2019, I was in Buenos Aires following the Paromas 40, the cooperation when President Macri took a plane, went to Chile, and Bolsonaro went there also, and they shot the mercy shot against SUS. The last day of the conference. It's a irony. So from there, we've had a very terrible process. In the last 10 months, the International Center for International Relations at Fiocruz, which I've had for a few years, has been studying the evolution, let's say, of health diplomacy regarding the pandemics based on the United Nations from the United Nations Health Systems, the World Health Association, and we have monitored the European Union. We have followed the Asia Pacific, the African continent, Brazil, China, and we are going to launch a book on that within 2 weeks. We had a seminar on the 17th, 16th. It's an online book with over 400 links that can be immediately accessed, and that will lead everybody to all references regarding world diplomacy in terms of COVID-19. I would like to invite all of you to visit that, and I want to send the access to all who are present here. And this book tells a little bit about this challenge. I'm trying not to enter the debate that we've had, and I'm trying to focus on Denise's question. My clock here says it's 12 o'clock, but I'm going to stay in the health diplomacy here. We're talking to students and alumni from Science Pool that forms it's so important forming people for international relations. What we see that the killing of UNASUL causes Brazil, and this is an express policy from Brazil in terms of isolation, because if Brazil has been focusing in uh, negations and getting so close to the American president, who thank God is leaving, it's a very dangerous problem. I mean, when our president doesn't even congratulate the new president of the United States, he's still profoundly connected to the negationism of President Trump and to the policy taken by this country regarding the policies of the WHS. Thank God we didn't leave it, but this is a critical situation. We all should be critical, but in this moment, it's not necessary to be critical to the attitude of the World Health Organization and the way they are. I don't understand the policy by the federal government. It's something it's impossible to understand. You can't, it's impossible to find explanations, rational explanation. Diplomats, students of international relations, it's impossible to find any logic in the way our federal government is dealing with all this. Nothing has happened in terms of the cooperation that could be very rich to all countries in Latin America. We have studied the CELAC, the Indian community, the public agents of CARICOM. We have examined the Commission of Ministers of Health for Central American. We have studied the Inter-American Health Association, and of securely, we have studied all documents published on how to recover from the pandemics with a minimum, and here I want to add something, uh, I want to add to the health systems, the social protection systems. It's not enough to strengthen our health system if we don't have the other aspects necessary to mitigate the determining factors of health, social protection, protection to labor, the right to water and basic sanitation that is basic at a time like this. So all these public policies and actions of the public power and how they affect the health system. The action has to be coordinated. We have to think globally and act locally. This is something we have been saying all the time. And when we start to talk about thinking globally, the message of the United Nations, I want to remember that Thursday and yesterday we had a general meeting of the United Nations on the pandemic. They had 31 special actions meetings of the United Nations. One of I'm lost on how specifically which were the specific topics, but now we have one on the pandemics on COVID-19 and what the that was said is registered. I suggest all students visit the United Nations web TV and you can access all the speeches they made yesterday and what they debated, all the delegations debated, and there were 90 interventions by international presidents. Of course, our president didn't talk. We had Nelson Araújo speaking. I suggest you watch it because it's a lesson, a live lesson on international relations and diplomacy on health, not only restricted to the WHO, but also in the scenario of the General Assembly of the United Nations. I wanted to comment on this, saying that it's terrible to find out that we are losing more and more leadership in Brazil. I had a modest role in the history of Brazil, representing Brazil and for 6 years in the Health Council and participating in all assemblies. Brazil was a country that was heard, admired, and with its great universal public health system, as Daisy mentioned, how much is being this system is being threatened, and this is terrible. And now what we see, a country that has been diminished not only by the negationism of the federal government, the formal leader of the country, but also by all the militarization of the health ministry, all the issues that are putting in question all the guidance developed in this country regarding the national vaccination program. Fiocruz is prepared to produce 200 million doses of vaccine during the 2021, 100 in the first semester, 100 in the second, the vaccine made by AstraZeneca. We are also being prepared to produce the vaccine of the death virus. It's a great vaccine. We made very good choice. And this is SUS. This is our unified public health system. The history that we have and is respected all over the world and is an achievement of the social uh, structure of Brazil. There is no other country all around the world with a public capability of producing vaccine that we have. Uh, Not even the large private companies that have uh, all these issues with the pharmaceutical industry. We will have self-sufficiency even at COVID-19, even if this theme of vaccine has been ridiculously transformed into a political theme, and as Daisy says, not in the formal politics, but in the poor electoral, most despisable action in terms of policies we have here in Brazil, even regarding our neighbors. This is a real problem, and considering what Denise asked me, I would like to close by saying that we urgently need to review our attitude regarding multilateralism, regarding the World Health Organization, and also regarding the participation of Brazil in regional Latin America projects. Brazil is out of CELAC, and we need to get close again to our uh, fellow. We can see some small light in the negationism with the new government by Biden. We don't exactly know what uh, this democracy in the North can produce, but uh, all the pressure on the Senate regarding the pharmaceutical industry, I don't know if they are going to bring some unexpected attitude by the North American government. But I think that due to what we've seen, we'll have a very challenging phase starting in January 2021, especially for us who work with health. Uh, uh, I want to invite all of you to follow the activities of Fiocruz. We'll have the second edition of Advanced Global Health Diplomacy that starts in January, and we'll have debates that ending now. They are facing the future. On the 16th, we have a seminar with Celso Morim with a balance of the situation of 2020 and a projection for 2021. We'll have a specialist on the area of social political economy to talk about the so-called new normal, as Deisy says, and a transformative action.
We have a great specialist in vaccine. We are going to have Pia Bia, who is going to talk about the multiple studies on clinical trials we've been developing. We also invited Winvid to answer the following question. International sanitary regulations required, but is it enough? We are going to discuss this on health reform and reformatting and all the new models for international health. I am all now available because I'd like to listen to you all again. And everything you've said before me was very important. So thank you very much. Thank you, Professor. It is important to have this idea because when we depict the international health, uh, and when you talk about the U.S. democracy, what we understand is that in Brazil we stop and forget to talk about the leadership and how they deal with the Latin American leadership altogether. It's a way of dealing with the pandemic in a process that is not only regarding articulation, which is necessary because of the vaccine, but also, unfortunately, it includes testing of people who are asymptomatic and the recognition of the need for isolation in these cases and the insurance of fundamental rights, for example, water, basic hygiene, and as Raul said, food and the regulation of economical activities, whether you should or should not have anything happening in protection lands, and how regional articulations are happening in the country and among Latin American countries. These are important and fundamental paths to follow. We need to remember that we started this pandemic with lack of basic protective material. If we do not go through a second wave, for example, but we do have an increase in the number of cases, we were just used to that plateau. We need to remember that protective equipment is important and it's lacking. The availability of such material is going to be lower and lower, and the workers are going to be even more tired. I thank you very much for this. We are, today is the 5th of December, and today is the National Family Doctor Day, and they are so important. And without the multi-professional team of the healthcare and nursing and dentistry and occupational therapy, they are all fundamental for the recovery on COVID. People looking for us with the post-COVID syndrome, and we could work towards all fronts of health, considering everything we've mentioned today. so far, and they all need to be addressed and worked through by Fiocruz and USP and all social movements. We need the Brazilian government to respond to all of that. We do have a question to Raull and to Eloy. If both of you can answer. We are a little bit delayed. We need to close by 12:35, so I'd like you to respond and also bring your final considerations to this debate. So a question to Raull and Eloy is the following. Both with the APIB and the crisis meeting, has there been uh, anything from the public government, from the government for the vaccination of the vulnerable population? How can we just not reproduce the international plan and look at such particularities? How have you been addressing this? Eloy, would you like to start? Sure, that's all right. Thank you very much to all of you. Thank you for the question. This has been a major concern. Before I answer the question, I'd like to reinforce, to stress this idea that this subsystem of the indigenous attention of towards health is out of the radar. In the people think that the indigenous people have their own system. The subsystem is within SUS, and the structure of support and primary attention towards the indigenous health, this is part of SUS. The indigenous population have that commitment of defending the public health in Brazil. Regarding vaccination, and this has been an object of consideration and concern among the indigenous leaders and with APIB. Yesterday, we forwarded a claim to the Supreme Court. They had a deadline to respond even. The state has presented the indigenous people as being a priority in this program of vaccination when available. Um, and I can say that this was nothing that came from the government. This was decided by the Supreme Court uh, and with the support of Fiocruz, because in the previous plans, the government didn't even mention anything about the indigenous people. And the specialists have elaborated this, and Minister Barroso has determined that this should have an addition to include the indigenous people in this document. So to date, this is what we have. There is a legal decision from the federal court ensuring health to indigenous peoples, to the indigenous people of Brazil, ensuring they receive the vaccine when it's available as a priority. And for final considerations, I'd like to thank all of you for the invitation. And I'd like to greet all the professors here, Raull, Paulo, and Deisy. Thank you for the commitment you have towards the defense of life, especially with the public health in Brazil. So thank you very much. Thank you, Eloy. Raull, well, I will start by thanking you. It's good to be here with you, talking about this urgent theme. It's our current moment. This is the moment to talk about this and insist on the topic. Just as Deisy and Paulo said, we are going through uh, diminution of this urgency from the federal government. They are spreading fake news as if they were truth, and this is made on purpose towards the society. And the black peripheral population is vulnerable. There is no care on what they say to this population. They are just thinking of the partisan political point of view, and this is a contradictory when they don't tackle their rights. and they tackle their own interests. We see this is important at the Alemão slums complex. We've been articulating because we need that this society thinks of this. The slums have been the primary targets and have been so impacted, and this is not to disappear when the vaccine comes in. The inequality is expanding as we speak in very fast, and this is going to increase unemployment, and the rights that were poorly insured are not going to be insured from now on, and the society needs to move towards this reduction of what we are facing. We are fighting, we are putting some pressure to receive the vaccine and the structure. KUFA and other institutions have been acting with this, but there are so many inequality layers that we are now living a moment of election. Uh, Government is changing. Everything was very complex and chaotic. And the crisis committee of the Alemão slum complex has saw that there is absence from the government. But these same institutions are present when it's disseminating violence and tampering with actions that save lives. And the public power on this sphere is present in a violent way, in a very bad way, tampering with articulations we carry out, for example. People like Eloy and all of us are important, but at the peripheral level, in the idea of the periphery in Brazil, these structures that are in the crisis committee are saving lives in the slums and in partnership with other people, of course. But this has played a central role in the number of the very severe numbers Professor Paulo has presented. We are organizing within chaos because we are abandoned, and there is the virus and there is the violence. We are organizing ourselves within this chaos to survive, and this is also helping the country, the city, and this has been taken into consideration as a central tool from 2021 on. We are talking about the new normal, but we have to remove this idea of normal from their speeches because it's racist, it's unequal, it's violent, it's genocide, and it's a different way of telling the story. We have to put that differently. We need to decentralize this ideal of Brazil. Just one more thing. I'm going to speak really fast. Here at Alemão, when we started mobilizing donations, we had two important figures, myself and Silva. And this is the Alemão slum complex. We all know them. We have visibility. It's a large complex. We are close to the downtown Rio. We are close to the main roads in Brazil, in Rio. We have important people in the complex. When we started the direct donation, many people came to talk to us, even people from other regions, from central regions, northeast, from other states. People wanted to donate to us, and we realized that although it was incredible knowing that people know us and know Alemão, and we saw this something really wrong. Our voices being heard globally when we understood of the centralizing solidarity, because in Rondônia and in Acre, they also have projects that are local for them, and they are needing support, and we need to reflect and think of Brazil. We have to stop thinking that Brazil is only the southeast part. We need to think that this we should not repeat this racism and segregating within Brazil. It's unacceptable in a pandemic situation, heading towards a second wave. Today, when we talk about the Alemão complex, we talk about problems where we have to remember that Amapá went without electricity for more than 20 days. We don't need to wait until the risk knocks at our door. 2021 is there, when we need to face our problems now. And it's up to us to fight this narrative. This is just so important that we meet to talk like this. With Deisy, Eloy, and Paulo and Denize, these are new people. I'm glad I know you now. Now I can believe that 2021. Sometimes we look to our sides and we think we are alone, but now I have you here. I know that we have you. We have to stick to that. We need to flip the page and move forward. People depend on us, and more we are the ones who are going to build the Brazil we want to. I'm sorry I took longer to finish, but hello everyone from the Alemão Slum Complex. Thanks. This is important.
It's important for you to mention the inequalities between regions and the necessity of decentralizing visibility and solidarity. I think this is also a product of what the news does, focusing on the southeast as a center of Brazil and ignoring the rest of the country as if it were the rest, but it's the most of the rural population in the country and all that, who are also fighting for survival. So, Daisy, a question for you. I'm going to read it and I'll ask you to make your final considerations. The connect us at the health services school is doing. What is the global evaluation of the actions of the public power in fighting COVID-19? I know it's a huge question for you to answer in such a short time, but Denise, I thank you for the question because it allows me to talk about the bulletin on the pandemics that is in its 9th edition that can be accessed at the site of For Conectas, Direitos Humanos, and also at the site for USP, that is are very easy to find in our and on Google. We present the number of federal regulations and some for 12 states in Brazil. We analyze the origin of these regulations, if it comes from the Secretariat of Human Rights, of the Ministry of Health, what regulations are these and how they affect human rights. We'll bring a bulletin on the whole of the 2020. It will be launched in 2021, and its terrible impact of these new regulations on the rights of people, and especially on specific populations. There are norms fighting rights and there are norms defending them. There's a huge fragmentation on Brazilian legislation because the subnational entities, state and city governments, had to rule on the pandemics in the absence of the federal government. There are several governmental regulations that attack rights, regulations that come to try to disseminate the disease. So some are resistance, other implementing measures. And I really agree with what Raull said. Brazil is full of examples of resistance to the catastrophes brought by the pandemics, but it's full of attacks, examples of attacks to public health. And we talk a lot about from the center of Brazil, and we need to see terrible things happening all over Brazil, but examples of excellent local responses to the pandemic. So there are a lot of, there's no mystery on where these responses come. There's no mystery of what is a successful response, but we need to give more visibility to them so we can show that it is possible. It is possible. We can and continue to have ways of doing it differently. But we have to realize there are terrible violations and terrible actions happening, and with all this fake news and fake debates that are we have to look at, like debating if the a vaccine is mandatory or not. Before, you have to have a vaccine to everybody, so we cannot talk to, that's not a fight for now. We have to say that it is important to apply, have the vaccine and to have the right to them. This is a team for everybody. But it's time for us to fight and have the insurance of our rights. And the pandemic has shown the disaster that is for the country to give up the rights it had achieved. This kind of analysis based on science that shows the path to where the humanity is going with uh, climate changes and global warming. I was listening to Paulo and remembering an article I published in 2014 on the WHO. And on that, I wrote it with Fernanda Perez, and we put the proposals from Brazil to the reforms and UNASU's proposal, where Brazil had proposals for UNASU, for the WHS, and we wanted to build a better World Health Organization focused on what we are mentioned today. So we knew that all that was going to happen. So why did our government seem so unprepared? International organizations planned innumerous plans for fighting pandemics, and we find the documents from years ago about this. If we knew this was going to happen and we were telling you that, why did it happen? And why did it call us unaware as it did? Because we were simply letting our rights our rights we had achieved being destroyed. If we fought for the effectiveness of these rights, we are now fighting to maintain them. This has to change urgently. We have to uh, go back to talking about our rights and to making them have become effective, and we have to use that language. We have the right to a decent response to the pandemics. We have the right to help people who are practicing lies that are very damaging to the pandemic situation of the pandemics. To, uh, holding these people accountable. They're all telling everybody you can go there work because we don't have things are getting better, and it's going to get very bad. And for in Brazil and all over the world, uh, if we don't uh, counter attack this discourse that want to have more Brazilians infected, more Brazilians dead, so this could end faster. I know the end of the year is a time of getting together, but if you want to get to the holidays in 2021, be on your alert now. Leave your perception, your faith, your perception of the world, leave it, but looking at the others, looking at the other people and to what is going to happen with our life next year. And turn this getting together into a fight in all possible matters at your disposal, because we continue living a crucial moment for the future of our country and for the future of each community and each group we belong to here today. A great hug to all of you, and thank you for this moment of great learning, great exchange. It is a real honor to have spent this time here with people I admire so much. All honors to the organizations, and great hugs to you. Thank you, Daisy. I think it is essential, this issue that you mentioned, the guidance that the pandemics needs to be controlled during this holiday uh, time. I'm going to talk to Paulo to Dr. Paulo with the hopes regarding the vaccination. There's great hopes that this is going to put an end to everything, and you lose the dimension that if you're thinking of human beings that share affection, the wish to be with your family and be together in 2021, we have a federal government thinking of 2022. The first this his cattle farm seems to be prepared, or you receive the vaccine, they will go back to an economic activity that would lead to their re-election. This is a necropolitics. This is a conscious genocide that we're watching, and we cannot watch this with our arms crossed. This is very important. But also, as affectionate beings, we need hope. We need this utopia on the horizon so we can go further. So vaccine seems to be a recurrent theme. So in these last questions, I'm going to thank Felipe, Vivian, who asked the previous questions, and Matheus Paiva, who sends these questions to Professor Paulo Buss, who's going to close our debate. What are the challenges in vaccinating a country with the magnitude of Brazil? And could this happen in the beginning of 21? How many vaccines and which ones are the ones we have a partnership already formed with, so we could start this vaccination campaign? A question for Matheus Paiva, and if you could answer and give us your final considerations, we'll be closing our debate. I want to thank all of you who have participated, the organizing committee, our audience. I'm very happy to be here closing this morning on this Saturday. Thank you, Denise. Thank you, Matheus, for your question. I think it's very important. We have a great experience in the national immunization program. It was built in 1975. It's one of the most respected programs in the world, and we have managed to reduce a huge number of diseases thanks to the PNI, the National Program of Immunizations. At some moment where I mentioned, we are not living only a pandemics, but a syndemics. The fact that we have a pandemics by the coronavirus has not changed the other problems we have, like traffic accidents, the matter of other diabetes, and all other health issues that affect the health systems. But this pandemics has diminished the treatment to all these other problems, and we have already a syndemics and the nymphademics with all the pandemics. So we have three problems united. The National Program of Immunization is preparing itself to face one of the aspects of this disease, that is the issue of the vaccine. There isn't a silver bullet. I want to make it clear that the vaccines that are being uh, uh, considered for Brazil, and the way we're going to apply and distribute this vaccine throughout time over the vulnerable population, the time immunity continues after a vaccine, the natural immunity that the people have had the disease has. We don't know how long they're going to last, how long the antibodies are going to last after the vaccine. They indicate that we're not going to put an end to community transmission with the vaccine. We don't even know how much the vaccine will really protect people from getting the disease. The most probable is that people will have the disease eventually, and they might get infected, but have a more asymptom brand version of those who got the vaccine, and the risk of a person who has been vaccinated getting to an ICU unit would be less than without it. what Denise and Daisy have mentioned. It's a genocide policy, trying to create a cattle immunity. The vaccine is not a silver bullet. It will not prevent community spreading. The community spreading of the virus will only be interrupted when we get to 70 or 80% of the population immunized either by the vaccine or by the natural having the disease. But we eventually, what we want to have is a, a weaker manifestation of the diseases. Some other vaccines produce a lasting, strong immunization against the disease. This is not the case with this. We'll have two vaccines prioritarily in Brazil. The one by Zeneca, which is called we have from that comes with the adenovirus of the monkey that will take the coronavirus to our cells, and those that are being created by Butantan in China, which is the one. Butantan is already working with the vaccine against the flu. These are going to be distributed in Brazil thanks to the SUS and to Fundação Oswaldo Cruz and to Instituto Butantan in São Paulo. We have the capacity to produce vaccines for the whole of the Brazilian population. Everything will depend on the cooperation action that I don't see happening now between the Butantan and the state government of São Paulo and the federal government. We have to to speak against the actions of the federal government. They buy they are trying to turn Butantan into something absolutely ridiculous. I hope they don't make a fight with this little politics.
On Friday at Le Monde Diplomatique, Sebastian Okada said he wrote a text on a speculative and unsustainable sovereignty and the multilateralism. If you are interested in discussing this, has been published online by the Le Monde Diplomatique. I believe this is part of this debate concerning the multilateralism. What is going to happen to the national sovereignty that are potentially defended by some actions, and namely United States and Brazil? America first sort of mindset in Brazil is in place, and we are questioning the sovereignty and the unbalance of this multilateral Brazil. I reinforce the invitation for the seminar on the 9th next week on the response of the Americas towards the epidemics on the coronavirus, with advanced seminars on health, and this is going to be broadcasted on YouTube as well. And on the 16th, the final seminar I've mentioned before. I thank you, Denise, and thank you for sharing the floor with with Daisy, Raull, and Eloy. And I've been learning for so many years. I've presented my PhD with Daisy. Daisy was there. I thank you so much. She said beautiful words during my PhD presentation, and Denise was coordinating the table. I salute you and acknowledge you, Mother Denise, in such a wonderful learning morning, sharing so many good things with you. It's the end of the Saturday in Paris, and we are just starting our afternoon here in Brazil. Rio de Janeiro has the sun shining bright today, and everyone all over Brazil. I hope 2021 is what Raul wishes for, a best 2021 with the commitment and the ensuring of all rights in this country. Thank you very much.